So today we're talking about the skin lesion here, and this is called Pyoderma gangrenosum. So let's talk about Pyoderma gangrenosum, what exactly this thing is. So when you have a look at the lesion, you see it's a violaceous lesion, and then at the same time, you'll be having a violaceous border, which is violet colored border. So violet colored border. And apart from this, what else do you have? We'll talk about what exactly this lesion is, but let's see, you also have a purulent base. So you see a lot of pus in the base of this lesion. So this is Pyoderma gangrenosum. Pyo, the word tells you there's pus, derma in the skin, and gangrenosum is sort of gangrenous appearing lesion. Now let's understand what exactly is Pyoderma gangrenosum. So Pyoderma gangrenosum is, first of all, it is a skin ulcer. You see, what's an ulcer? An ulcer is break in the normal epithelium, and that is what is exactly happening here. So it is a skin ulcer, the first thing, and it is a form of neutrophilic dermatosis. So you must have heard about neutrophilic dermatosis in some diseases like that are like some GI diseases where you will have neutrophilic dermatosis, and the idea here is that you have a lot of neutrophils in this. When you do biopsy of this lesion, you'll see a lot of neutrophilic inclusion bodies. Now, why does it develop? So nobody has an idea about what it is. Why does it develop? But what happens is you have a trauma. So there's a preceding trauma to the skin, and then you happen to develop this lesion and skin lesion, and this is actually called pathergy. So this phenomena of developing a skin lesion because of trauma is called pathergy, and around 30% people with Pyoderma gangrenosum do have this pathergy test positive. Now, at the same time, what are the risk factors, and what is the epidemiology? So females are at more risk than males for this. The age group is going to be 40 to 60, and apart from that, there is association with any sort of an inflammatory disorder, whether it be IBD, it be rheumatoid arthritis, or even cancers, malignancies. So that is one thing as well. Now, when you do skin biopsy of this lesion, you'll be able to see a lot of neutrophils. There's mixed inflammation though, but in the mixed inflammation, you happen to see a lot of neutrophils. So that's the reason it's called neutrophilic dermatosis. One important idea here is that when you look at this lesion and they happen to ask you the treatment for this lesion, some of us get stuck. What would be the treatment for this disease? And so surprise, the treatment here is steroids. So for some reason, the treatment for Pyoderma gangrenosum is steroids, unlike Dapsone for neutrophilic dermatosis associated with some GI disorders. So let me try, and the steroids can be local or systemic, any of them. Even systemic steroids are sometimes given when the disorder is not going away. So let me just repeat it for you. This is a skin ulcer, which starts as inflammatory papules and pustules and maybe nodules that progress to form this expanding ulcer with a fibrinous or purulent base, and it has an irregular violaceous border. 30% of these lesions are in fact triggered by local trauma, that is called pathergy. There is an underlying systemic inflammatory disorder, mostly like IBD, rheumatoid arthritis, or cancer, or any other for that matter. Even, for example, AML can trigger it because it's a cancer. Apart from that, so it is usually diagnosed clinically after you exclude other causes of skin lesions like infection or cutaneous ulcers and stuff. And also the last thing is surgical. And what some questions may tend to ask you, would you do surgical debridement here? And the answer is surgical debridement is contraindicated, because you understand this is caused by, in fact, because of injury. So do you want to do more injury and kind of expand this lesion more? The answer is no, and hence the treatment is going to be steroids. And that sort of wraps up the discussion on Pyoderma gangrenosum.